Hi, my name is Dr. Lindsey Zubritsky, and I'm a board-certified dermatologist. Today, I want to go over with you how to get rid of a pimple. So the first thing is the most important thing. Do not touch your pimple. Do not pop your pimple. That is rule number one. When you touch and when you pop your pimple is when you lead to more inflammation of the acne and potentially scarring and damage to your skin. It can even make the pimple last longer. So do everything you can not to touch that pimple. So if you want to treat your pimple at home, there are a few things you can try. So first, I do not recommend trying to treat your acne at home. It's always best to see a board-certified dermatologist to treat your acne. But if you get the occasional pimple every now and then, it's safe to treat it at home. So here are the first few steps that I recommend. First, the second that you start to get your pimple, I recommend that you clean the area with either a benzoyl peroxide wash or a salicylic acid wash. Make sure your hands are also nice and clean before you do the next few steps. If you're trying to get rid of the redness, I recommend ice or heat. Ice can calm down the inflammation and reduce the redness, while a warm compress can also reduce the inflammation. The next thing I recommend is a spot treatment with an over-the-counter acne product containing either salicylic acid, retinol, or retinoid if you have that prescription, or benzoyl peroxide. Another good treatment for your pimple is to use hydrocolloid patches. They sell these at the pharmacy. Some of them are medicated and contain something like a salicylic acid. Others are just a hydrocolloid dressing, which decreases the inflammation, reduces the bacteria, and decreases the redness of the pimple. Things that do not work for your pimple are the home remedies you've probably heard of. That includes toothpaste. Do not put toothpaste on your pimple. It does not work. It's just an old wives' tale, and you're wasting your time and causing even more damage. After you've tried a few of these tips and tricks and your pimple is still not improving, now's a good time to call your dermatologist and make an appointment. In the office, we can do the injection with a corticosteroid. Just a little injection can help calm the inflammation down overnight. It's great when you're in a pinch, but I do not recommend that you do this consistently. When you have acne that is persistent and constant, you can't keep coming to the dermatologist for injections. There is a risk that every time we use a corticosteroid injection into the skin, that we could cause a little divot in the skin called atrophy. So I only recommend this for emergencies. So when your acne starts to become a problem and you can't keep up with the amount of pimples that you're getting, that's a good time to go to the dermatologist and seek professional care. We have many treatments that we can give you, including multiple different topical agents as well as oral agents, and we might even offer something like a light therapy treatment to help your acne. Please don't waste your time and money at home looking online or using social media to look up acne removing products that contain witch hazel or acne pimple zappers. They usually don't work, and sometimes they can even cause more damage and harm. So it's best to leave your acne treatment up to the professionals. So seek advice from a board-certified dermatologist.